Hello, everyone. Welcome to episode 42, where we will be discussing Piriformis Syndrome, all things prevention, treatment, everything. I am your host, Dr. Janae Brown, and I am your host of the Physical Therapy San Pedro podcast. And I am joined by our two amazing physical therapists at Physical Therapy San Pedro. To my left is
Dr. Bay.
And to my right,
Dr. Yana.
Yes, ladies, Piriformis Syndrome. Dr. Bay wrote this amazing blog post, and we're going to discuss it today. So Dr. Bay chose the posterior hip. Dr. Bay, tell us why. Why did you choose this syndrome?
Yes, thank you. I was given the recent opportunity to be challenged by the Piriformis Syndrome on my caseload.
Yeah.
I've been actually researching this before we even went into our hip series because I have a patient case on my load right now that the diagnosis tricked me. It was we'll discuss it more later, but it was a more difficult situation to diagnose. So I had been researching Piriformis Syndrome and found it very interesting. For those of you that don't know, a true Piriformis Syndrome, which we'll talk about how to isolate that later, is not entirely that common in the field. I've only had a handful of cases of true Piriformis Syndrome in my career, but the piriformis muscle, a lot of us, like all the lay people out there, everyone's familiar with Piriformis Syndrome and how to stretch it.
Mm-hmm.
Everyone's really caught up in piriformis with low back pain things. It's a big buzz thing out there when you're looking up understanding the body.
Mm-hmm.
But today we're discussing a true Piriformis Syndrome, which may be different than just activating or stretching it. The piriformis muscle is also pretty cool in terms of its function. It has a few more not very common functions compared to some of the other hip muscles. So we'll dive deeper into that when we talk about anatomy. So I just found it to be a very interesting topic for myself and currently helping my patients.
Awesome. And Dr. Bay loves the hip. I just want to clarify that so everybody knows that she's not just a foot person.
Yes.
She's also a hip
I
person.
love all the body parts, waist below.
Multifaceted.
Those are my favorite is lower body.
Yeah, she likes lower body. So, Dr. Yana, you're going to take us through anatomy, talk to us about causes and some symptoms.
Mm-hmm.
I see LeBone James joins you to your right.
Yeah, he's back.
His butt is facing us this time, his backside. So we're going to be all things glute and booty impeached today. So the floor is yours.
Alrighty. Okay, so today's main structures of focus are going to be the piriformis muscle and the sciatic nerve. So in previous episodes, we have covered pretty much all of the hip and gluteal muscles. But as far as today goes, piriformis muscle is up first. So this muscle originates at towards the bottom of the sacrum here. And then it runs all the way and attaches to the top of the femur. So that's its orientation right there. And then the sciatic nerve, it does originate in the lumbar spine, and it actually travels underneath the piriformis muscle. And so the piriformis, as far as actions go, it's an abductor, external rotator, and it can also be an internal rotator depending on how the leg is positioned. All right. And so in Piriformis Syndrome, what can happen is that sciatic nerve that runs under that muscle can be compressed by the muscle, causing usually localized pain in that hip region, but it can also be felt in the upper thigh. There's certain factors that can cause inflammation in this area. Some of them are a lack of strength in the piriformis muscle. If you're lifting heavy loads without proper body mechanics, not participating in a good warm-up before you exercise, any type of like overuse or repetitive motions in activities like distance running or cycling. Sitting can also cause it. So if you're sitting for prolonged periods for things like work or school. And then occasionally, if there's an abnormality in the sciatic nerve or the piriformis, it can contribute to this as well. So things you want to look out for symptom-wise are aching or burning in this region, or again, the upper thigh, numbness or tingling in the glute area. And then that's why it gets a little confusing. People confuse it with sciatica a lot because of the radicular symptoms that are felt. and sitting for long periods as well. And then hip stiffness and tightness and restricted range of motion in this area as well.
Yeah. So those are some of our causes and some of the symptoms that we see. In order to be diagnosed with Piriformis syndrome, you need to see a healthcare provider. So that would be a doctor who can diagnose you with the problem. That could be your physician. That could be a doctor of physical therapy or a physical therapist. Or you could see a chiropractor, potentially acupuncturist. You want to see a healthcare provider that is a doctor who is able to diagnose you with that problem. As Dr. Bay said in our pre-time, not a massage therapist, not a personal trainer. You want to find someone. A lot of these people are familiar with sort of those conditions and things, but they may work with them, but they don't typically they're not typically the person that would diagnose you. So they're familiar. They've worked with Piriformis syndrome. They may be massaged through a type Piriformis, but you really want to see a healthcare provider who is a doctor. And so that doctor that you see, you could end up in your physician's office. If you end up there, your physician might run some tests to differentiate whether this is something coming from your back, truly your glute. They might want to do an ultrasound, an MRI, a CT scan. They might even do an X-ray if they're concerned about some bony abnormalities and things like that. Or you're going to end up at a physical therapist's office or chiropractor, acupuncturist who will do more clinical testing. So that'll be things like feeling around on the tissue, taking you through movement tests, checking your flexibility. What does your range of motion look like? Do you have signs and symptoms that take us towards that you have this problem, which is Piriformis syndrome, or that maybe it's something else like sciatica? And that's what we're going to discuss too, because the common sort of differential diagnosis with Piriformis syndrome that we see is sciatica often, and sometimes it can be a little bit confusing. So I'm going to talk a little bit about those differences between what Piriformis syndrome, how sciatica would look different from Piriformis syndrome. So Dr. Yana talked about some of those Piriformis syndrome symptoms. How sciatica would different is sciatica typically is coming from, we'll start in the low back. So it could be that you have a disc herniation, which could be creating pressure onto the nerve roots that exit your back. Those nerve roots that exit your back, they join together in the gluteal region below the piriformis, and those create the sciatic nerve. And that sciatic nerve travels along all the way down to the knee, where it splits off and becomes two different nerves that go down to the foot and ankle. But when we have pressure at the back on that nerve, it could create sort of pain along any one of those lines, numbness, tingling, just irritation all along that pathway. So typically with a sciatica, you're going to see that someone might have some pain in the low back, some stiffness in the low back, irritation in the low back, weakness in the low back, some of those things. And it could be herniation, or it could also be like a stenosis. So when you have a spinal stenosis, that's narrowing of the canal, which also can squeeze on those nerves and sort of create a limitation or irritation in the nerve roots that exit the spine. So the big difference between sciatica and Piriformis syndrome is you're going to see with sciatica a line that goes from the back, and it's always not a straight line, but you're going to see somewhere along that line pain, numbness, tingling. It could just be in the foot. You could just have like numbness and tingling in the foot and nothing anywhere else, or maybe just numbness and tingling in the foot and maybe pain in the low back, or you could have pain in the glute where the piriformis is, and a little bit of a line of pain all the way down to the knee. So it looks a little bit different because sciatica and radiculopathy can be challenging and a little bit more, what's the word I'm looking for? Complicated, complex, a little bit more than Piriformis syndrome is. In addition, with sciatica, it can be on a radiculopathy, or it could be on both sides. With Piriformis syndrome, typically, and Dr. Bay is going to talk about a case that's not typical, but typically we see it just in one glute on one side. And it typically happens in a way that is very easy to differentiate from the other side. So I think I covered everything in terms of those differences. So did I miss anything that you guys wanted to add in terms of what you've seen with the differential diagnosis?
think you got it.
I think the only one thing that I've actually forgot to write in the blog, so more
Okay.
on the
Tell us.
podcast than on the
Yep.
blog, is in more severe cases of lumbar radiculopathy or stenosis, that there could also be weakness present. So depending on the level, a big thing would
Yes.
be like weakness, like foot drop or quad weakness, causing like the leg to feel like it's giving way.
Yes.
So those are also signs that it's coming more from the spine than it is from the hip.
Yeah. And basically, you're going to see hip weakness in both of those, right? But what Dr.
Yes.
Bay is saying, you might see, weakness down the chain, maybe
Yes.
in the, hamstring, maybe in the calf, maybe in the foot and ankle, right?
Yeah. And
Yeah,
those
lower
spine
down.
conditions she discussed cause a lot of hip muscles to either have increased tone or spasm
Mhm.
or weakness. So that looks like an irritated piriformis.
Yeah, absolutely. Yeah,
And we often treat the piriformis for those conditions.
we do.
True.
It's
So-
often part of that plan. Yeah.
Yeah.
So once you figured out whether it's sciatica or Piriformis syndrome, and you know it's Piriformis syndrome, then you need to tackle that with some treatment. And so our favorite thing, of course, to do in terms of treating it is physical therapy. But Dr. Bay is going to go over all the things you can do, all the options, which will land us with some specific physical therapy things. And she'll go over those things with us because she picked this one, and
Yes,
she's going
thank
to teach us
you.
all about it.
Yeah.
All right.
Several of us have Piriformis syndrome on our caseload right now. So we're
Yes.
all treating it or have treated it before. But number one is once you get diagnosed or you feel like you have this pain in your backside, your bottom, your butt, your glute, you need to land yourself in a physical therapist office because this is where the primary treatment takes place.
Mhm.
Where once you're in our office or you've seen your medical professional, the first thing you're going to be assigned to do is rest and modify your activity. It's very important that you let the tissues kind of calm down, bring the pain levels down, avoid activities that would be aggravating. We don't want to keep repeating and exacerbating for this syndrome. Occasionally, in more severe cases, medication might be used. Medication for pain, inflammation, or reducing the spasm of the muscle could release pressure of the muscle pressing on that nerve and create a little bit more space in that zone. Our favorite is physical therapy, which I'll touch on more in a second. But in case physical therapy is not successful, in very rare cases, surgery might be needed to clear maybe some scar tissue or other sources. Some of those maybe anatomic abnormalities might need surgical intervention if the condition is not responsive to conservative treatment, which is physical therapy. So once you enter the physical therapist's office, we'll also conduct our initial evaluation, which does all those clinical tests Dr. Brown talked to you about, and we'll also be kind of reviewing how you move for your sport, checking postures of your aggravating activities, and we're going to be employing some treatment techniques. These include manual therapy, so we might be using our hands to improve the mobility of your muscles, the mobility of your joints. Different tools help with that. I'm a big fan of mobilizing the hip with the belt to traction the hip socket open and stretching the piriformis with that kind of traction. That's a recipe that works pretty good for me with my hips. And then re-educating the muscle through those ranges that we get so we keep the range. Another big one is strength training. As we discussed earlier, one of the causes is a weakness in the hip region. So I like to target the piriformis from the different angles that it works. So we learned from Dr. Yana that it can be both an internal rotator and an external rotator. So I like to have my patients work on internal rotation of the hip strength in more of a flexed position and external rotation in more of an extended position. So we can target all the different fibers. And of course, our abduction exercises, there's a plethora of those that we could use depending on the phase of therapy that we're in, more open chain in the earlier stages and more closed chain and functional as we progress back towards activity. We're going to be sending home a home program of mobility, flexibility exercises, making sure you're very independent and how to keep the length of your piriformis syndrome and activate it properly. Another big one is balance drills. The hip is very involved in how we balance. So we want to be challenging the stability of our hip and making our balances more and more complicated and also making sure they apply to the activities we're trying to get back to. The next one is movement reeducation. So that might involve PNF principles, which means proprioceptive neuromuscular facilitation. So that could be done with the physical therapist, hands-on. We might be reeducating you throughout the ranges, or there's different tools or different trains of band exercises, maybe that might be in PNF patterns. And then also just kind of breaking down how you're moving and making sure that your alignment is proper. You're initiating your movements from all the right places. All of those are movement reeducation techniques. And the last one, and the one that we feel is so important here because we work with so many athletes, is the return to sport guidance, right? Once something is healed, you can't just do whatever you want.
Yeah, that's right.
You need to step back and make sure that you're progressing and increasing loads, increasing volume, increasing intensity in a thoughtful way so that your muscle and the condition does not get re-aggravated. And, you know, I work a lot with dancers. That's my passion in all sports, but I'm, you know, right there next to my patient talking, okay, now you've made it this far through class. Okay, your symptoms have remained down. Now I'm going to excuse you to increase your dance hours by this much or complete the class fully now. We're going to have lots of those talks with our patients as they return back to sport. Then once you're all the way better, we're so happy. We would love to see you continuing your strength and conditioning program always. We have classes here for that, or we can guide you in that. But a lot of people are also interested in prevention. I hear this from a lot of my athletes' parents all the time. How can I prevent this from happening to my son or daughter, right? So let's talk about how we can prevent piriformis syndrome. And this is going to repeat a lot of the things we discussed with the causes earlier.
Yep.
So how can we prevent this? Number one, don't skip your warm-ups. Properly warm up. Do your mobility and activation drills to make sure these muscles are ready to support you through all your dynamic activities. Avoid sitting for long periods of time. Practicing good posture, not only when you're sitting, but also during those activities or your sports or your training. If you break your posture or alignment, you're going to be overusing certain muscles, and that's when things kind of break down. And then last one is cross training. Keeping variety in your routine keeps the overuse of certain muscles down and keeps the body well balanced, and it can work as a unit together. If you can keep all those in mind, if you need help, we love to help you work all that stuff in and make an ideal program for you.
So good. So good. I like how she said, you don't get to do whatever you want to do when you're feeling better.
I know that because I've tried
Yes.
and it doesn't work.
That's the best. Okay, so let's talk about some patient cases here. So everybody here has seen, had at least one case of what we think is piriformis syndrome and a case of sciatica. So let's talk about how we might treat those differently. So if you had a piriformis case, what would you might do differently with that piriformis case versus someone who is more of a sciatica case? You guys have anybody want to start?
I can. So
Okay.
with my piriformis case, I'm really honing in harder on hip strength and stabilization on one leg than I would on a sciatica patient, where those I'm more working on general core stabilization and in the beginning stages, especially working on things that would decompress the area.
Okay.
That's how I changed courses when I discovered that my patient had piriformis syndrome.
Okay.
I like to look at if there's muscular imbalance.
Mm-hmm.
So like you mentioned, if they're overusing one side more than the other, I usually look at leg length discrepancy as well. And like, as we know, I like my hip reset sequence.
Yes.
So that has
good.
proven to be beneficial I currently only have one patient right now with piriformis syndrome, but that seemed helpful to him.
For me, with a sciatica patient, I'm really targeting the lumbar spine first and trying to centralize. So I'm going after like press ups and core stabilization and trying to figure out where that like radiculopathy, where that sciatica is going, if it's into the calf foot, wherever it is, and trying to get it up, get it towards the, the back.
Back to the source.
Yeah, back to the source. Yeah, because a lot of times people don't feel anything in the back. They're like they think they don't have a back issue because they don't feel it in the back, but that's because the sciatica is overriding. And I have a patient right now where it's been overriding the back, and now that we're higher up the chain, he's like, I'm feeling it in the back now. So
That's good.
yeah. So
Centralizing.
that's actually my strong man who has that sort of problem right now, Mr. Martinez Lisi. So we're having that issue where we've had to figure out what is it and how do we get it to centralize. And sometimes it takes time to do that. But the key things are avoiding the irritants, like Dr. Bay was saying in the beginning, finding the places where that person can do things. For example, for him, hinging is very painful, right? When you hinge, you put that sciatic nerve on stretch, or going down to touch the toes, you put the sciatic nerve on full stretch, or doing a straight leg raise, you put the sciatic nerve on stretch. So finding places and ways to move those body parts without irritating the sciatic nerve, and keep checking in with that. Like, okay, what can I do today? What can we do today? As the weeks progress. With Piriformis syndrome, I typically go straight after that piriformis and that hip first, and I'm working on soft tissue in the piriformis. I usually can palpate and if I press on that piriformis, it's pretty strong, deep pain. With the sciatica, you don't really have that either. You might not have like deep, tender pain when you press on the piriformis with the sciatica. And so you always can usually feel it. And so I usually go after soft tissue and really proximal hip strength and stability. Is where I usually target for my Piriformis syndrome patients first. So I'll go after the glute med, and I'll go after, hip extension, and everything, all the four muscles, adductors, external rotators, internal rotators. I'll go after all the proximal short positions of the hip and focus on strengthening there. Yeah. It's kind of like your hip reset.
Yeah.
But yeah. Any other thoughts on patients that you're seeing, or guidance you'd want to give our listeners and followers out there that might be some sauce about how you do things with a Piriformis syndrome, or what you think might be helpful for them if they're suffering with a Piriformis syndrome?
Well, I just wanted to share my tricky case
Yeah,
and
go
how
ahead.
we
Share
got
it.
to the diagnosis,
Yep.
just so no one else gets tripped
She
up.
was bamboozled, guys.
I was.
It's
tricked me,
surprising.
and
You're not often bamboozled.
I was bummed that I got tricked, but I've learned from it, and now I know. So the patient I was currently treating, and I've treated this patient for a long time because she has a rare autoimmune condition that's just leaves her muscles very weak because of not only the condition itself, but the medication she has to take to treat it. So we were treating primarily her knees, but I knew she had a history of a back surgery of a radicular problem, right? So we discussed this earlier. Radiculopathy smells like Piriformis syndrome.
Yeah.
So
yeah, it can be. Yep.
all of a sudden, this patient had gone on a road trip. Now, we learned that sitting brings this on, but I didn't know that at the time. And this patient does travel a lot. Frequently, they go on 4 and 6 hour car rides to different vacation homes that they have. So this road trip was longer than normal. So then she came back with pain in both butts and numbness in both upper thighs. So I thought, okay,
double cheek pain.
Knowing the history of this patient with the back problem, I really thought it was spine source because it was bilateral. After a couple weeks, her stronger leg is the left and her weaker leg, the worst knee, is the right that we treat. So the left resolved after a couple of weeks, but the right remained very severe. And I had since referred her back to her spine doctor, and I was treating, like we discussed, more for like lumbar spine core stability, but I wasn't making a huge difference, unfortunately. So then I was so embarrassed because the back image showed nothing. I was like, oh no.
A beautiful back.
So, but then based on their palpatory and physical exam techniques, they confirmed Piriformis syndrome.
So what would you have done differently in your diagnostics? Maybe would you have palpated?
I probably would have palpated more specifically, but it was hard. It really, to me, I always say the term smelled like back because it was bilateral, and she had the history, and she is weak on both hips already, and she's weak in her. And her butt is tight on both sides. So it was, but now I know like that big key thing for me was the sitting.
Yeah.
That was the trigger. And that would have led me now that I have studied it more.
Yeah. It's confusing. It could be very confusing, but I think being thorough, and there's always something that gets us sometimes, but I think, sometimes what we love about having each other is being able to have each other see each other's patients too. So when something is lingering for a little too long, also having a team and oftentimes I'll say, Dr. Bay, can take a look at this because it doesn't look like something I've seen. So leaning on each other is great too. This particular patient, only sees Dr. Bay, so I know why
Well, you're
she
gonna
didn't
see
do
her
that
tomorrow,
Yeah,
actually.
oh, exciting. I'm excited about that.
Test it out.
Yes. So, well, that's all we have for you today. We're going to close out with telling you that if you have Piriformis syndrome, we want you to find a healthcare practitioner in your local neighborhood, find a PT, seek treatment out. You can see us virtually or in our clinic. So feel free to reach out to us because we're here. We would love to help you. Also, you can find more information about this particular topic on our website. You can look at this on our Instagram page, Facebook. You can go to our YouTube page at Physical Therapy San Pedro. You can go listen to the podcast at any listening platform that you so choose to listen at, Spotify, Amazon, Apple Music, wherever you listen. So tune in. We have a lot of other hip topics that we've discussed, but we're ending our hip series and we are going to move into, I think we discussed back series next. So stay tuned for that back series. And we thank you for tuning in, and we look forward to bringing you guys more content in the future. Have a great day, guys. Bye.
Bye.